All right, this is Steve Heuer, physician assistant, talking about life after surgery, the first 3 months. All right, as you're moving from surgery, really the focus is on fluid intake. Fluids for the first 1 to 2 weeks. Drink your water, drink your protein drinks, broth, V8, that kind of stuff is fine. You'll move to period food after that for a few weeks. That's food that's blended to the consistency of very thin applesauce. And then after that, you'll move to soft foods and then more standard foods. Again, water really important. It's nutrient number one. We say to get 80 ounces in, but it's just not that possible. If you can get about 40 to 80 ounces in a day, that first week or two after surgery, you're doing very well. Sip, sip, sip. Drink enough to pee 5 to 8 times a day. Make sure you're getting something salty, such as broth, in as well. Dehydration is the number one reason for ER visits the first week or two after surgery, so make sure you're getting hydrated. If you're struggling with this, please call us. We can get you into the clinic and give you some IV fluids if needed. If you're living far away and you can't make it down to Madison and you need to go to your local ER, make sure that you're asking for a banana bag, IV banana bag. Protein. During the first week following surgery, it's important to get water on first. Yes, try your protein drinks, sip, 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 but if your protein drinks are filling you up such to the point where you're not able to maintain adequate water intake, if that's happening, then I want you to take a break for a day or two from your protein drinks and focus mostly on water and broth, and then try the protein drinks again. Okay. By the end of the first week or so, if you're getting 1 protein drink in a day, that's great. By the end of the second week or so, if you're getting 2 protein drinks in, you're doing fantastic. Pills. So your stomach is small and it's swollen for the first few weeks after surgery. This might make it a challenge to get certain medications through your stomach. So think of your stomach as the size of maybe your thumb or so for the first week or so. If you're taking pills that are really, really large, break them into smaller sizes, particularly if they're tablets. If you have 5 or 6 pills that you typically take at once, you're just not going to be able to do that for the first week or two after surgery. So splitting that out across maybe an hour, so take a pill, wait 10 or 15 minutes or even longer, and then take another one. That's the better way to get your medications in for those first few weeks after surgery. Again, tablets that are bigger than an eraser, pencil eraser, or your small pinky can't easily cover it, those should be broken into smaller pills. Capsules and gel caps tend not to be as much of an issue because they dissolve so quickly after you swallow this. About 3 weeks after surgery, you can go back to whole pills and taking multiple pills at one time if needed. Your stomach swelling is gone by that time, typically. So it's really important as far as supplements to make sure you're getting that B complex that you swallow and the B12 under your tongue or through the nasal spray. Those are really the only 2 vitamins that I would worry about in that first week or so. Then, as the swelling is going down, you can gradually, one by one, add in all the other vitamins that we ask you to take. It's not a race. As far as activity, resting is important. Sleep, sleep, sleep. It's okay to nap throughout the day. Just make sure you're either setting an alarm or having somebody wake you up every hour or so during the day to get a little water on board. Walking around the house or outside is fine. Just don't push it. Going up and down stairs is fine as long as you have a railing. Do not lift more than 20 pounds. No vacuuming or heavy exertion until you're further out from surgery. Typically around 6 weeks post-op, sky's the limit as far as what you can do. Just ramp up gradually. Showering is fine. Do not submerge your incisions. No bathtubs or hot tubs or anything like that until about 3 or 4 weeks after surgery. It's okay to have sex around 10 days after surgery, depending on how you're feeling. Buyer's remorse, this is fairly common. Folks are struggling with some pain, some discomfort, fatigue, the challenges of getting adequate hydration and whatnot, and they're thinking, what have I gotten myself into? And this is normal, understandable behavior. Don't give it any more power than that. This will get a lot easier as you move from surgery and the healing progresses and those habits really set up nicely. But certainly call us and let us know how you're doing, and we can help support you for that through that period. We want to make sure that you're keeping an eye out for strictures, okay, particularly for bypass patients. About a month after surgery, 5 out of 100 of our patients, 5% of our patients who have bypass will have a stricture. If this is you, what happens is a scar that connects your stomach to your intestine gets too tight and food just doesn't move through, and you end up regurgitating it. It's typically not painful. There's not really any nausea, just some regurgitation. If that happens, give us a call. Let us know what's going on. We'll order an endoscopy to take a look down into your stomach to stretch it out. If there's a stricture, and we'll ask that you go back to more pureed or watery-based foods or protein shakes. Your abdomen's going to look funny. You'll have scar tissues and bruising and puckering and dimpling. It's all very normal. It hurts to move and twist and turn and cough and get up from sitting or standing. That's all very normal after laparoscopic abdominal surgery. Keep an eye on your incisions for infections. If they're getting red, warm, swollen, draining, pain that doesn't make sense, it's likely that this might be infected. It's very uncommon, but it can happen. Let us know if that is the case for you. Overdoing it can be an issue. A lot of folks feel great about a month or so after surgery, and they ramp up their activity and then strain the deeper incisions. So yes, slowly increase your activity, but slowly and gradually, and listen to your body. Dumping syndrome can occur at any time if you consume too much sugar or fat, particularly if you had the bypass surgery. This is a self-limited phenomenon where you might feel flushed, nauseated, lightheaded, increased abdominal discomfort, sometimes vomiting, often diarrhea. You may have some or all of these symptoms. It typically resolves on its own and almost always triggered by sweets, sometimes fatty foods. Be aware that cold and flu remedies, if they're liquid-based, often have alcohol and sugar in them, and that can often trigger a dumping reaction. So try to avoid those types of medications. Frothing happens if you've eaten too much or too quickly, or maybe you didn't chew your food well enough and you irritated your esophagus or pouch. That promotes significant mucus production, and you will regurgitate that. It's the sticky, clear, copious amounts of mucus, and that's how you interpret that. If you have that, something you did, somehow the way you ate irritated your esophagus. Constipation can occur. You typically do not have bowel movements for the first 10 days or so after surgery. Your first bowel movements are usually soft and dark. This is just digested blood. But some folks do have constipation, so it's important to take Colace, over-the-counter Colace, twice a day until you've had your first couple of bowel movements. After that, you can add fiber, or certainly if you're having loose stools, you should stop the Colace. If you're struggling with constipation, you haven't had a bowel movement, it's been more than 10 days after surgery, please call us and let us know that this is going on, and we'll help guide you. It's important, of course, to drink more water. Sometimes adding a little bit of Miralax to your water twice a day can help. Sometimes increasing your fiber can help. Diarrhea and bad gas. There's a lot of things that can cause this. Typically, it's a food-based, either too much fat, too much sugar. Certain food products or components can trigger diarrhea and bad gas. Keeping a food diary is very helpful for us to try to determine what might be going on here for you. Nausea can occur if you eat too fast, eat too much. Sugars or other certain foods can trigger nausea. Not eating enough, not drinking enough, certain medications, and of course you can always get the stomach flu. Various things can cause nausea. It's important to remember that surgery is a tool or an airplane and you are the pilot. Not following the rules can lead to all sorts of symptoms and problems. Habits drift, distractions, interruptions in routine, injuries, illness, old habits are still there. So being aware of these crosswinds in life, it's important. You're going to drift a little bit. This is life, but being aware of this can help. Involving friends and family and coworkers can help keep you on track. So eating rules, keep your portions small. Remember, one bite can be all it takes to be too much and trigger discomfort, frothing, or vomiting. Chew your food. When in doubt, spit it out. Your stomach can no longer chew your food for you. Eat slowly without distractions, and do not drink with or after your meals. Wait about 30 to 60 minutes before you add fluids back in. If you're eating too fast, you're going to have discomfort. Bubbles can also cause discomfort, so stay away from carbonated beverages. Certain foods just do not go down well, and this varies from person to person. Typically, these are dry meats, such as chicken breasts or steak. Thick-skinned foods, grapes, lettuce, or similar can sometimes be a problem. Breads, pastas, and rice can often be cause discomfort, along with raw veggies. Everyone's different, so it's trial and error. Keeping a food diary does help. Certain foods you just don't tolerate, such as milk-based products. This is a lactose intolerance. Sweets and other foods can trigger GI symptoms or gut symptoms. it's important to remember if you're using a powdered-based protein shake, when you mix it up, to let it sit for 10 or 15 minutes to allow the bubbles to come out. Otherwise, if you drink it too quickly, it's hard to get that gas out. Adjusting fiber up or down may be necessary. Sometimes taking a probiotic such as Florigen or medications such as Imodium or altering your iron intake will be necessary to address your GI symptoms.